Hello students, myself Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Our today's topic is manual and mechanical exercises. On the basic topic of types of strengthening exercises, today we will be dealing with manual strengthening exercises and mechanical strengthening exercises. Let us start. So first let us know about what are manual and mechanical exercises. From a broad perspective, a load can be applied to a muscle which is contracting in two ways. Either we could give it manually or we could give it in a mechanical way. For a broad perspective, we could give it both ways, even if patient has taken it himself or with the help of a therapist or an external equipment. So what are manual resistance exercises? First thing is about the manual resistance exercises. So manual resistance exercise is a type of active resistive exercise in which resistance is provided by a therapist or other health professionals. A patient can be taught how to apply self-resistance to a selected muscle in this also. Although the amount of resistance cannot be measured quantitatively, this technique is very useful in the early stages of an exercise program. So when we are starting an exercise program, it is better we give a manual resistance exercises. When the muscles to be strengthened are basically weak and can overcome only the minimal or moderate resistance exercises. Now what are the characteristics of this manual resistance exercises? First, they are preceded by active assisted and active exercises. As we start the exercises, we start them with active exercises, active assisted exercises, then active exercises. This is a part of strengthening. Then as the patient is able to perform active exercises, we start off with manual resistance. This has a proper impact on muscular strength and endurance. Exercise is carried out in the anatomical planes of motion in diagonal patterns associated with PNF techniques or in a combined patterns of movements that stimulate your functional activities. For example, you start the person, you tell him or her to perform the functional activities and give mild resistance in those activities. So here you could see in the first diagram, you can see a female therapist is giving active or is giving manual resistance for shoulder elevation and flexion. Second, you could see she is giving manual resistance for hip flexion. So what are the principles of manual exercises? Manual resistance exercises, basically body mechanics of the therapist is basically used here. The height of couch, how we are aligning the patient, how is the therapist positioning himself. These things are the basic things which has to be taken care. Application of manual resistance and stabilization includes proper stabilization of the proximal parts, then manual contact at the exact point where we have to give it, and the placement of resistance should be near the insertion. Now resistance, we have to grade resistance, which grade we have to give, and the resistance will vary. The amount of resistance will vary according to the patient. Now application. Gradually apply and release the resistance so movements are smooth and not uncontrolled. Hold the patient's extremity close to your body and keep on giving verbal commands. Verbal commands are very important. This will help the patient to initiate the movement patterns. Verbal commands should be simple, direct verbal commands which are coordinating properly. Then you have to make sure that you are having proper determinants for your manual resistance exercises. That means you have proper frequency, you have proper duration and intensity, number of repetitions, sets, rest interval, everything should be predetermined. What are advantages of manual resistance exercises? These are most effective during the early stages, as I told you earlier. These are effective form of exercises for transition from your assisted to mechanically resisted. They lie between assisted exercises to mechanically resisted exercises. These are more finely graded resistance than your mechanical resistances that we will see how, because you could adjust the resistance throughout the range. For example, if your patient is able to take 5 kgs in early range of the movement, but then in the later ranges he is not able to take more than 2 kgs. So you can modify your resistance according to the patient's ability and if there is any painful arc. Muscle works maximally at all the portions of the muscle. That is why you are giving different modes of resistance. The range of joint movement can be carefully controlled by the therapist to protect healing tissues, or you can also prevent any kind of damage. Useful for dynamic and static strengthening. Direct manual stabilization prevents substitute motions which patients could take if he is not able to complete the range. These can be performed in a variety of patients' position. Placement of resistance is easily adjusted and gives the therapist an opportunity for direct interaction with the patient throughout the range. So you can directly contact the patient and identify when you have to increase or decrease or modify the resistance depending on the patient's response. But there are disadvantages also to the manual resistance, like exercise load is subjective. It is very subjective. For example, if me treating a patient, the load could be different, and if the therapist heavier than me treating a patient, the load could be different. Next, the amount of resistance is limited to strength of the therapist. Little value of strong muscle groups is given in such exercises. The speed of movement is slow to moderate, which may not carry over to the most functional activities. Cannot be performed independently by the patient, so you cannot give it as a home program. Labor and time intensive for the therapist. This is one drawback for the therapist. It does give back pain and muscular pains to the therapist. Impractical for improving muscular endurance because it is too time consuming. So these are the disadvantages for manual resistance exercises. Now we will start the mechanical resistance exercises. What are mechanical resistance exercises? They are any form of exercises in which the resistance applied is given by an equipment. These could have resistance training exercises, weight training, strength training, and these are always an integral component of the rehabilitation program or an athletic training or sports rehab program. What are the characteristics of these type of mechanical resistance exercises? First, these are implemented in rehabilitation programs mainly to eliminate or reduce deficits in the muscular strength, power and endurance. These deficits are mainly caused by an array of pathological conditions, and we have to restore the functional abilities. So we give these mechanical resistance exercises. These resistance training complements aerobic training and flexibility exercises in conditioning programs. Now there are lots of advantages of mechanical resisting as well. First, it establishes a quantitative baseline measurement of muscle performance against which improvement can be judged. Most appropriate during intermediate and advanced phases of rehabilitation. As we already see, manual exercises are given in the early phases of rehabilitation. Mechanical are basically appropriate for intermediate and advanced phases of rehabilitation. When do we give them? We give them when the muscle strength is between 4 to 5 or greater than 4, anywhere greater than 4, so that the therapist's strength will exceed, the patient's strength will exceed the therapist's strength. That is where the mechanical resistance comes in part. Heavy resistance loads far beyond that which can be applied manually by a therapist can be used to induce a training effect for already strong muscle groups. Other advantages are there could be increases in the level of resistance which can be incrementally and quantitatively documented. Here you can document it that the patient is able to take 10 kgs. While you are giving a manual resistance, you cannot document it. Quantitative improvement is an effective source of motivation for the patient, because if the patient is able to take 2 kgs in his earlier days and then in later days he is able to take 20 kgs, he himself gets motivated. It is useful for improving dynamic and static muscular strength, adds variety to a resistance training program, and there are some equipments which provide variable resistance throughout the range, making it effective in different ranges of exercises as well. High velocity resistance training is possible and safe with some forms of mechanical resistances like hydraulic and pneumatic variable resistance machines, which are very commonly used nowadays, isokinetic units, and elastic resistance training like you are using your therabands, therapeutic, that could be also helpful. Potentially better carryover to functional activities than relatively slow velocity manual resistance exercises. Then these are appropriate for independent exercises, so you could give the patient to these exercises as home exercises, or you could also let the patient to perform these exercises under a period of supervision. Now, as they have advantages, they do have disadvantages also. These are not appropriate when the muscles are very weak or soft tissues are in very early stage of healing. At that time, we will give manual strengthening itself. Equipment that provides constant external resistance maximally loads the muscle at only one point in the range of motion. No accommodation for a painful arc. This could be achieved. There are exceptions like hydraulic pneumatic devices. There you could set range in different, you could set resistance in different ranges. So painful arc could be checked. Expense for purchase and maintenance of the equipment. As manual are very less expensive, they are least financial burdening, but these are expensive equipment, some of them. With free weights and weighing weight machines, gradation in resistance is dependent on the manufacturer's increments in the resistance. Now let us see what are the different equipments for resistance training. There are lots of different equipments we will be using for resistance training. First are the free weights and simple weight pulley systems. The types of free weights which we can use in exercises could be dumbbells, barbells, weighted balls, cuff weights, weighted vests, and even sandbags and free weights. Simple weight pulley systems could be also used. Permanent or interchangeable weights are available in such systems. Free weights and weight pulley systems are resistance equipments that will impose a fixed load on the contractile tissue. Here you could see different things. In the first diagram, you could see a patient doing activities with a medicine ball. Then these are the weights and the dumbbells. This is the pulley system which you could use, and these are the free weights dumbbells. And what are the advantages of these free weights and simple weight pulley systems? Exercises can be set up in many positions. Many muscle groups in the extremities and trunk can be strengthened by simple repositioning the patient. These are used for dynamic non-weight bearing exercises, but also can be set up for isometric exercises and resisted weight bearing activities. Stabilizing muscle groups are recruited and a variety of movement patterns are possible. For example, if you are using a dumbbells, you could strengthen a variety of muscles in different types with the help of dumbbells. Due to lack of external stabilization, it needs to be controlled and it requires the assistance of the spotter. Always remember the amount of resistance is fixed in such devices. Second, what we could use are the variable resistance machines. Variable resistance machines are where we could vary, or we could have different types of weights or different categories of weighing systems here. In this, we could use a specially designed weight cable, which is weight pulley system, and a hydraulic and pneumatic units. Variable resistance weight cable systems or the multiple pulley systems which we can use, and we have also these in our labs. These are the variable resistance weight cables which use a cam in their design. The cam in the weight cable system is designed to vary the load which is applied through torque. This is applied to the contractile muscle even though the weight selected remains the same. This system varies the external load imposed on the contractile muscle based on the physical dimensions of the average individual. With each repetition of an exercise, the same muscle group contracts and is resisted concentrically and eccentrically respectively. Here you could see we are using the variable weight. We are using these weights, you could see here in this machine, which is using these weights with the help of pulley systems to strengthen your pectorals, pec machine. So this could be used. Then there are hydraulic and pneumatic variable resistance units. Here machines employ hydraulic or pressurized pneumatic resistance to vary the resistance throughout the range of motion. These units allow concentric reciprocal muscle work to agonist and antagonist muscle groups, but no eccentric work. Patients can safely exercise at fast velocities with these units. These units are also allowing patients to accommodate for a painful heart. This you could see, we are maintaining the hydraulic devices with these footsteps and the handbars. What are the advantages of these variable resistance machines? The effective resistance is always adjusted, at least to some extent. For example, you could use 2 kgs, 5 kgs, 10 kgs. So it could be variable according to the patient's ability to take the load. The contractile muscle is loaded maximally at triple point in the range. Most pieces of the equipment are designed to isolate specific muscle groups. Each unit provides substantially external stabilization also, क्योंकि ऐसे ही रखा जाएगा कि externally stabilize किया जाए आपके movements को. So आप जो trick movements होते हैं उनको avoid कर सकते हैं. The equipment is adjustable to a certain extent. Most machines allow only single plane movements, although some newer units do have a dual axis. The main disadvantage of these is that the initial expense and the ongoing maintenance costs are very high, and after few years they become old, so new designs come and they are not useful, quite not useful for your department or your laboratories. Third type of strengthening is done by elastic resistance bands and tubing. We will be having a separate lecture on therabands, but still let us discuss about these. Equipments using elastic properties used for resistance exercises basically are the elastic bands and tubings. Then the therabands, elastic resistance bands and tubing. Elastic bands are available in an assortment of guides or thickness. Tubing comes in graduated diameters and wall thickness that provide progressive levels of resistance. How we will identify which has how much of resistance depends on the color coding, which denotes the thickness of the product and grades of resistance. Here you could see a female, she is doing band exercises. You could see at different levels. Here she could see for doing it upper extremities, lower extremities, back, could see lower extremities. So different exercises being performed. Fourth type of exercises are equipments which are used for closed chain training. Mainly closed chain exercises are performed in the weight bearing postures to develop strength, endurance and stability across multiple joints. Typically, these exercises use partial or full body weight as a source of resistance. So, we could mainly use it in two types: body weight resistance, multi-purpose exercise systems which are mainly used in gyms, and balance boards, slide boards, trampolines, rebounders, which could be used anywhere from gyms to your labs and OPDs. Body weight resistance are multi-purpose exercise systems. These enable a patient to perform bilateral or unilateral closed chain strengthening and endurance exercises in positions that range from partially reclining to standing. These exercises are mainly used in gyms. The level of resistance on the total gym apparatus is increased or decreased by adjusting the angle of the glide board on the incline. Here you could see, you could change the angle of the glide board and vary the resistance. This is mainly used in gyms. Then there are balance boards, or you could call them as wobble boards. These are used for proprioceptive training in the upper or lower extremities. This system can be used in standing position, seated position for ankle exercises or for quadriceps positioning and strengthening. The progressively increasing the size of half spheres under the board or placing weights on the board makes the balance activity more challenging. So, this is the progression of the balance boards. This you could see, this is the balance board. If you keep on maintaining the balance there, you could see the patient is having strengthening and the proprioceptive, increased proprioceptive intake. Then you could do lower extremity strengthening by giving mild turbulences to the balance board. Then there are slide boards. These consist of a moving platform that slides side to side across an elliptical surface against adjustable resistance. Although it is most often used with the patient standing for lower extremity rehabilitation, but it could be sometimes used for upper extremity closed chain exercises or trunk stability also. Medial, lateral or anterior posterior movements are mainly possible here. You could see these are the slides. We could use these slide boards for the strengthening. Then there could be mini trampolines or the rebounders. Mini trampolines enable the patient to begin gentle bilateral or unilateral bouncing activities. These are done on a resilient surface to decrease the impact on joints. The patient can jog, jump, hop in one place. These mini tramps have a waist height bar to hold on to provide additional safety to the patient so that he does not fall or she does not fall. See, these are the mini trampolines. Nowadays we have lots of articles giving the effect of mini trampolines on lower extremity stability and strength. Then there are reciprocal exercise equipments. These can be used for closed chain training. Reciprocal exercise devices strengthen multiple muscle groups across the multiple joints. They are also appropriate for low intensity, high repetition resistance exercises, to increased muscular endurance exercises, reciprocal coordination of the upper and lower extremity, and basically we use them for improving cardiopulmonary fitness. So, reciprocal exercises equipments are basically used for cardiopulmonary training, or we could see endurance training or in aerobic training. They are often used for warm up and cool down also, prior the exercise and after the exercise. In these we have lots of exercises like we can use stationary cycles, we could use steppers, joggers. Stationary exercise cycles, these are used to increase lower extremity strength and endurance. An upright cycle requires greater trunk control, so you are working on trunk and balance than a recumbent cycle. A fewer exercise cycles provide resistance to the upper extremities as well at times, and lower extremity की strength तो increase होगी ही होगी cycling से. Resistance can be graded to the challenge the patient. कैसे? By modifying distance, speed or duration. Okay. Passive devices resist only concentric muscle activity as the patient performs pushing or pulling movements. Motor driven exercise cycles can be adjusted to provide eccentric activities as well. The placement of the seat can also be adjusted, जिसके से आप trunk stability and lower extremity की strength पे भी work कर सकते हैं. This is the picture of a static cycle. Static इसलिए क्योंकि एक जगह पर आपने इसे रखा हुआ है. Paddle करते रहेंगे. Bicycle ergometry is the basic thing which we do with the help of static cycle. Then there are portable resistive reciprocal exercise units. These are used for repetitive reciprocal exercises. Resistance can be adjusted to meet the abilities of the individual patients. Then steppers, stair stepping machines. Stepping machines that allow the patient to perform reciprocal pushing movements against adjustable resistance to make the weight bearing activities more difficult. Stepping machines provide non-impact closed chain strengthening. A patient can also kneel next to the unit and place both hands on the foot plates and can use it for upper extremity closed chain exercises. तो लोअर अपर दोनों के लिए आप स्टेपर को यूज कर सकते हैं. लोअर के लिए पैर रखिए, अपर के लिए आप लीन डाउन करिए और हाथ इसके ऊपर रखिए. Then there are elliptical trainers and cross country ski machines. These provide non-impact reciprocal resistance to the lower extremities in an upright weight bearing position. This you could see a jogger. It is very much used in gyms. Then there are upper extremity ergometers. These provide resistance exclusively to the upper extremities. Typically the patient is seated, okay, then he can use upper extremities to position. This is a upper extremity ergometer. You can see he is seated, there is a foot placement, and then the upper extremities could be used as cycling machine. Then we could use equipments for dynamic stabilization training. In this, the basic and the most important thing which we use is a Swiss ball or the physio ball or stability balls. These are heavy duty vinyl balls, usually 20 to 30 inches in diameter. These are used for a variety of trunk and upper lower extremity exercises. A patient can also use elastic resistance or free weights while on the ball exercises. Then we could use body blades. These are dynamic reactive form of resistance equipment that uses the principle of inertia as the source of resistance, and these are basically used to give dynamic stability. You could see here in this diagram a patient doing trunk stability exercises on a physio ball or a Swiss ball. Then the last is the isokinetic testing and training equipments. We have this in our department. These work on dynamometers which provide accommodating resistance during dynamic exercises. The equipment supplies resistance proportionally to the force generated by the person while he is using the machine. We could preset the rate, that is the speed, and then give the exercises. These could be used at both training exercises also and as a diagnostic tools also. Here in this diagram you could see in our department we using the isokinetic device. Here we are trying to check the lower extremity strength. This is what we are using for the diagnostic purpose. So this was about the manual and mechanical resistance exercises. I hope you all understand it. If anybody has any doubt, you can contact me on my phone number or WhatsApp me or email me. Thank you so much. See you in the next class.